way it can be available for them too, or what would you like? Just to leave the, I guess, the website in, and then you can do the video some other time? What would you like?
We can do either, really. Kirsten, what do you think?
Okay.
Either is fine.
Okay.
Okay. I can just proceed as if I was in a lecture hall, right?
Yeah.
Perfect.
Yeah.
Excellent. So hopefully this is fine, and you're all welcome to change anything you think is not appropriate, because this is a tough age to lecture to. So I did my best to say PC and PG 17 or 16, whatever it is. So let me share my screen. And it says here, host disabled participant screen sharing. Oh, are you able to give me permission?
Yes, it should
There
work
you go.
now. Yeah.
Thank you. And I think it's gonna be from here. No. Okay. No matter how often I do this, I always have like a little, there we go. Okay, this is the talk right here. I have my technical support right next to me. Never leave home without him. Okay, so let me start the presentation. And this is right it here. And present. Okay. Can you see and can you hear?
Yes. Yes.
Okay, very good. So let me go back to the first. Okay, so here we go. I'll start as if I were in a lecture hall. So good afternoon, everyone, and thank you for inviting me to Zoom in and spend an hour or so with you talking about a not very comfortable subject, sexually transmitted infections and diseases. And whenever there's something a little uncomfortable, it's best to be factual and honest about it. So that's what we'll do hopefully for our next few slides. And another title for this talk can be, instead of STIs and STDs, it's how to stay safe from STIs and STDs, because that's basically the reason we're having this meeting, how to protect ourselves from STIs and beyond that, STDs. What I thought we could do first to bring us into the thick of the subject is a little video produced by the CDC, and it's a great way to start the talk. It gives you a full spectrum of the talk, and then we can just go one at a time.
For some reason, we can't hear the video.
You can't hear it?
No.
You can't hear it.
If you go to the top, there's an option that says share computer sound. That might work.
Those are difficult because they're not
Does
curable.
that work? Okay.
Yeah.
Chlamydia and gonorrhea we think of together because in both men and women they cause similar problems. In men they cause inflammation of the inside of the penis, urethritis. And in women they cause inflammation of the cervix and the uterus and then the fallopian tubes, producing pelvic inflammatory disease.
Condoms are really important in helping prevent the spread of STDs. Condoms work very well to prevent HIV and trichomonas and gonorrhea and chlamydia.
Syphilis causes both sores or ulcers, but it can also cause infection throughout the body, leading to rashes, and in rare cases, neurologic problems. Syphilis is efficiently transmitted between mothers and babies. We now realize that virtually all the sexually transmitted infections can be transmitted that way.
Trichomonas, or trick for short, is a little parasite that often goes undetected. Trick makes you 3 to 5 times more likely to contract other sexually transmittable diseases such as HIV.
Herpes simplex virus, or commonly known as herpes, is a viral condition that causes recurrent outbreaks. Blisters can form in the genitals.
There's herpes in your mouth and there's herpes in your genitals, and the only way to know which type you have is through a blood antibody test.
Hepatitis B is not always recognized as an STD, but it is.
Hepatitis B is a virus that can be passed on through sexual contact and through blood-to-blood transmission. It causes inflammation of the liver.
HPV is a viral infection that's associated with a number of genital tract outcomes, including warts, and in rare cases, cancer of the cervix, the penis, the anus, the vulva, and the vagina.
HIV is a sexually transmitted disease that can be passed on through sex, or it can be passed on from blood-to-blood contact. Your risk for getting HIV can be increased 2 to 5 times in the presence of a sexually transmitted disease.
The real danger is in not knowing that you have an STD and don't treat it. All of us are at risk if we're having sex, which is why we always say, protect yourself, protect your partner.
There we go. So I figured nothing better than having the specialist for the start. And now let's go back and continue with the talk. Again, thanks for bearing with me here, everyone. Okay, for some reason, I have lost my slides. Where are we, slides? Let me go back to Google and get my slides here. Google Slides. See what happens when you get older. Slides.
You're making me feel better. It's okay. The first week of teaching online, I was like, I don't know how to do any of this stuff. It's a rough learning curve.
There we go. So we start, go back here and share screen and go back to that.
Okay, yeah.
Okay. Thanks for bearing with me, everyone. So let's go back and into the thick of the talk. So let's go back to the definition, STI versus STD. When I first started off in medicine, it was always STD, STD, and that sort of had a negative connotation to it. An STI is when we have an infection in us. So the virus or the bacteria is in our system, but there is really no disease. And that is when we touch someone and the virus or bacteria makes its way into us, but no signs of disease, no burning, no pain are yet apparent. And the only way to protect ourselves from STIs is by taking precautions, by being safe. And it could be days, it could be weeks, it could be months. An infection can then take over the body's function and cause disease. So pain, fever, chills, and beyond that. So STI, the illness is, the virus is in you, the bacteria are in you, but you have no symptoms. The STD, the disease is apparent. There are different misconceptions about what safe sex is, and it's really important to bring that up first thing. Kissing is thought to be safe And it isn't. If you're worried about herpes, that's how kissing can happen. It doesn't even have to see a cold sore. It can still be there to be transmitted to you. Also, mononucleosis, known as a kissing disease, it can be transmitted via kissing and sharing drinks and food. Another thing is condoms. Many people believe that if you use condoms, that's the end to all your worries. But whether it's STIs, STDs, or even pregnancy, condoms may not be fully protective. So the first thing to lay out here is guidelines for safer sex. It can never be completely safe, of course. If you ask the purists, they will say the only way for keeping yourself completely safe is abstinence. But in the real world, here are some things to keep in mind. Please have one partner at a time. And with that partner, even with them, think twice before starting relationships with a new partner. Ask them, how many partners did they have in the past? Don't assume if they tell you, I love you and I'm seeing no one. Please don't assume they're saying the truth necessarily. Ask them about their history of STIs. Have they had cold sores? Have they had any issues in the past? The CDC recommends a specific kind of condom to keep you extra safe. That is latex condoms, with or without spermicides. Some people prefer other condoms, like the ones from polyurethane. Those are not as tight, and as a result, may give people a different sense of, pleasure and, I guess, relaxation with them. But they are not as safe or thinner, and they can tear easier. And also, quote unquote, natural condoms. Those are very loose, very thin, and may not produce as much relaxation, protection. Now, if you do have a latex allergy, of course, but please, first things first, latex condoms are the best, especially for men. And that also holds for oral sex. Keep yourself protected, please. After intercourse, females should not douche because it can just spread any infection in the cervix throughout the body. So please, no douching after intercourse. See your healthcare provider regularly, especially as you get over 21 with consistent exposure. You do need pelvic exams and periodic tests for STIs. Another thing to be careful about is your partner's body. Be cautious. Look for signs that could be a problem, like open sores or blisters, a rash, discharge anywhere. And do that too, please, for your body. Every day after you shower in your privacy, please check for those signs: sores, blisters, rashes, discharge. And consider the safest sexual activity. Depending on your intimacy of your partner, please consider other than vaginal, oral, or anal intercourse. Who do you turn to for safe tips and advice? There are many respectable sources. You can start with the American Academy of Pediatrics, the AAP, the WHO, the CDC. If you have a healthcare provider, please ask them. And it could be someone you trust, whether it's a school nurse or a teacher, even family. If you're in a close-knit family and you trust, a mom or a dad, please go to them. Finding the right healthcare provider may not be as easy as you think. It is really important to nurture a working relationship with your healthcare provider, a physician, nurse practitioner, physician assistant. Please find someone you can visit regularly and even send emails to with any burning questions. That healthcare provider should treat you with respect, should listen to you, should encourage you to ask questions. And if you ask questions, they should explain the questions you're concerned about. They should also recommend services that you're interested in, where to go for testing, where to go for shots. And if you have concerns about STDs and STIs, they should guide you as to how to screen for them, treat them, and then prevent them. And if you need a specialist, like a gynecologist or endocrinologist, dermatologist, they should be happy to refer you to them and not hold back any further services. And when you go to see your provider, please make a list of questions that are important to you. Don't wait till the last minute. Don't wait until you're at the doctor's office. Your mind may go blank. Here are some questions you may be asked and you should be ready to answer. They're going to ask you, have you been sexually active? If you're not asked that, then the visit is not complete. They're going to ask you who you have sexual relationships with. We're going to ask you about the number and the kinds of sexual relationships. Please expect those questions. And if they're not asked, then stop the physician and ask them, may I please talk about my sexual history? That should be always on the table. Now, in sexually transmitted infections, there is a spectrum of risk, from the safest thing you can do with a significant other to the riskiest. And by far the safest, if you look at the left here in purple, is hugging, touching each other over clothes, and touching in general. You go on to the next safest, which is kissing with, a closed mouth, and just go down that list, down that list. The riskiest by far is anal sex. So you go from the safest to the riskiest. Let's take a little quiz here. Do you have to have sex to get HPV? You heard that being mentioned in the little video clip from the CDC. HPV is a virus which causes warts, but can also cause cancer. And the fact is, HPV has been detected in almost half of women prior to their first intercourse, because HPV lives in our skin. And it's hard to believe that 75% of Americans already are infected with HPV. This is HPV. The picture on the left, that's a person who is just covered with warts and molluscum because they have HIV most likely. The second picture, this is warts or molluscum HPV on the vocal cords. The picture after that, that's just one solitary wart, HPV again, in a healthy person. And the last one, this is a swollen tonsil. This is a cancerous tonsil with HPV. So HPV has many different faces, and it starts even before sexual intercourse. If you are a swimmer, if you're an athlete, it's going to be there on the wet floors, in the shower stalls. So HPV is just waiting to colonize your skin and then spread during sexual activity. And it can take decades before you show up with cancer. So please be careful. There is a vaccine for HPV. That is probably the only vaccine that was produced to protect people from cancer. Not just cervical cancer, not just penile cancer, but also cancer of the throat and the mouth, about 60,000 cases in the US. And this is a vaccine that is offered to people. Before the COVID vaccine, this was the most recent vaccine created by the pharmaceuticals. And it has 3 different types. It is safe. It is provided to everyone. Please ask about it. If you get it before you turn 15, it is just 2 shots, 6 months apart. If you wait until you're 16 or older, it will be 3 shots, 2 months apart each. So there are vaccines for STIs, just 3, HPV, hepatitis A, and hepatitis B. All the other STDs and STIs still do not have any vaccines to prevent them. And let's go back now into the list of the most common STIs. And here it is. Chlamydia, number 1, herpes, warts, HPV, gonorrhea, hepatitis B, syphilis, trichomonas, and HIV. Those are the most common, but there are others. And if you look at the distribution of those STIs, the one on the left, this is the US in general, and you see how, again, chlamydia accounts for more than half, with the second being trichomonas, the third being gonorrhea. In the middle, you have something from Oxford. And you see chlamydia again comes up first, but herpes is second. And then go up to Cornell in New York State. Chlamydia is also number one, but not as much, followed by gonorrhea. Let's go back to STI risk factors because it's all about safety. So please, what's the most dangerous? Anal intercourse, vaginal intercourse without a condom. Stay safe, everyone. Get tested, reduce risky behaviors, get vaccinated. Now, how soon do symptoms appear? How soon can an STI become an STD? If it's gonorrhea, it can be 2 days, it could be a month. If it's trichomonas, up to a month. Syphilis, up to 3 months later. And then HIV, it could be years. Herpes, within 2 weeks, absolutely. Hep B, it can also be days and days. And STIs by age group. You can see how if you go by gonorrhea, 70% of cases of gonorrhea in the US are in the age group of 15 to 24, so young people. Same thing for chlamydia, 63%. HPV, half. Herpes, almost half. And here we go also by sex. So HPV, men and women, female, male, the same, 4% for both. The herpes simplex virus, genital herpes, women are about 6 times more likely to become infected and persist with those infections. Chlamydia, also more women. Gonorrhea, women more, up to 7 times more. So why is this? There are 10 reasons why STDs and STIs impact women in a different way than they do men. Number one, of course, is the anatomy. Because the lining of the vagina is much thinner, it is more delicate, and any sexual intercourse or chafing will allow bacteria and viruses to penetrate the woman's body much faster. Number two, what happens sometimes is that symptoms in women are not as prominent. So women can go for days and months without feeling or seeking help. It should go down the list, how women and men are different. The good news is women typically see their healthcare providers more frequently than men, and they talk more openly about their issues, so they are more likely to get checked, and that's great. Please be honest, seek help, and get tested. Now, STIs, unfortunately, some of them are forever. I'm not sure if you know that song from a James Bond movie, Diamonds Are Forever, but so is herpes, and so is HPV. So can syphilis be. If you don't treat syphilis early, it's probably going to be forever, not just for you. Hepatitis B is also forever. Hepatitis C, forever. So please be careful, protect yourself. And this is another chart where you can see how every single one of those STIs is transmitted by unsafe sex. And if you take care of yourself using the appropriate condom, you are much safer. Let's go to the individual diseases. Chlamydia, it is by far the most common STI and STD in the United States, but often it presents with no symptoms, which means it's an STI, so you can transmit it from person to person, but not know about it. But maybe one of your partners will get the brunt of the symptoms and have an STD. And most of the symptoms for women and men are discharge. In women from the vagina and men from the penis. There'll be burning, and there can even be bleeding in between periods for women. You'll have to feel the urge to pee more. And then it goes from just a simple STD to a much complex STD in women, PID, where the bacteria just spreads from the uterus into the fallopian tubes, the ovaries, and then into the whole abdomen. That can be a huge risk factor for women. And then in men, it can also infect the testicles and cause orchitis. Treatment, easy. Ziframax. You'll be given Ziframax, and you can take it in one shot, one gram, and you are hopefully treated well. And whatever there's chlamydia, there's gonorrhea. They go together. And same thing, as you can see, for men and women. Penile or vaginal discharge, burning, painful urination, frequent urination, sometimes fever. And by the time you get chills, something serious is happening because it can spread from the private parts throughout the body. When it gets into the blood, it can go anywhere. You can see the picture on the left. It's in the tongue, glossitis. It's in the knee. Gonorrhea, for some reason, loves the knee joint. If you have, or if your friend has, a sore, red, swollen knee, ask him, are you sexually active? And then you can see the picture on the far right, abdominal pain. That's when women and some men have it spread to their liver, and that can be also serious concern. So joint infections can cause permanent damage that can affect your sports career. Please protect yourself. And then unfortunately, gonorrhea can be passed from the mother to the baby. And babies get it first in the eye. And yes, we do erythromycin ointment to try to cure the baby, but if it's not caught in time, those babies can end up with blindness. Treatment, easy enough, but not as straightforward as chlamydia. Instead of 4 pills of Zithromax, you get a shot of Herceptin. And those can be painful. People have known to pass out after a Herceptin shot. You can get local soreness and redness at the site, some nausea, diarrhea, but it is essential and it is protective. Next is a STD that is I guess we called it at that time a brothel, and he had relationships with many women, and he contracted that disease. And to get back at them, he painted that picture and caused a furor in southern France. And the picture on the far right shows a baby affected by this illness, and you can see how emaciated that baby is and how in tears the mother is. This is syphilis, and you can see what it looks like under a microscope. About syphilis far too much that they figured maybe Shakespeare had syphilis. The other picture here on the right depicts a sad era in our for how syphilis, as you can see, those poor men who were left untreated developed some of the horrible end results of untreated syphilis, which I'll share pictures of. And it was a little too late when President Carter apologized publicly to the survivors of that horrible experiment. It's a progressive disease. It doesn't stop. If not treated, syphilis just doesn't stop. It goes from phase to phase to phase. And here are some of the pictures: sores, lost body parts, and holes in your skull. And you can see how widespread it is. Here are some of the cities where it is most prevalent. In the Bay Area, syphilis is divided into 4 stages. The primary, everyone will get, and it happens about a month after exposure, and it's just one innocent-looking sore, which we call a chancre, which you may miss. And if you miss it and you don't get treated, lo and behold, 2 months later, you will have a generalized rash and fever and chills. And if you don't treat it then, So syphilis will just go into hibernation for a year or 2 or 10 years, and then wake up in a devastating fashion, or where you just get lesions and sores throughout your body, anything from your heart to your brain to your bones. And here are some just reminders of how it spreads everywhere during the secondary and the tertiary phases. And there you go. This is secondary syphilis. You can see how the rash is spread everywhere. It can look like measles. It can look like hand, foot, and mouth disease. It can look like a cold sore, but it's not. And if you go beyond that, see those sores. Same here, poor circulation leading to and then if you go on, it's a web of disease. So it goes to every part of the body. You can see how some people will lose some body parts, especially in the face, poor circulation. And then the brain, you see I have a picture on the left. The left part of the brain is completely stroked out. And then the cranium, the skull, has also been eaten away by syphilis. And it doesn't stop there. It does pass to children during pregnancy, from blindness to rickety bones to lost teeth and mental retardation. Next, here you have some innocent notes promising, eternal love. And what are you passing? This is it a cold sore or is it herpes? And ignorance is not bliss. So when they have a blister, please don't assume anything. Don't assume it's a sun blister or a stress blister. Please assume the worst once you get it confirmed by a physician or a nurse practitioner or a physician assistant. So it starts off mildly, and when herpes infects you, it will never leave your body. It will just sleep in those nerves, and every so often, whether you have a test stressing you out or whether you have too much sun exposure, it will wake up and will cause one or more blisters recurrently. It can also go into the eye, and that can cause blindness. This is ocular herpes. It can go into the nerves, like the nerve that innervates your face, and cause paralysis. It can cause something similar to shingles. Very painful, can go on for weeks. And the worst of all is herpes encephalitis. If it spreads to the brain, it can cause an infection of the brain, seizures, and brain damage. So 5 things about herpes. It is a virus, so there's no cure. It is different types. Classically, type 1 is the oral cold sore virus. Type 2 is the genital herpes virus. But because sexual practices have changed, you can have both type 1 and type 2 in genital herpes and oral herpes. It is transmitted by direct contact. And again, please be safe. And you can see how usually by age 5, 90% of humans have already been infected by type 1 herpes, the oral herpes. But by adulthood, probably like 50 million people, quarter of women and American men, have been infected by type 2 genital herpes, and 85% of them don't even know it. So we just transmit it to each other back and forth. So an STI, not an STD. And again, it's a web of illness, like we described all the different kind of illnesses herpes causes. Let's repeat them one more time. Oral herpes. So you go from a little tingling. If you feel a tingle or a little numbness, don't assume it's thirst or, sunburn. It could be the beginning of herpes. And then you go to a blister, which bursts and then scabs over. And in about a week or 10 days, it's healed. Genital herpes, the same, but instead of one, it's multiple. Intense burning sensation with or without the blister showing. There's so many home remedies. I wouldn't use hydrogen peroxide, because hydrogen peroxide will destroy some of the herpes, but also the normal cells and delay healing. Aloe vera can cause some comfort, but again, will not usually treat it as fast. Ocular herpes, you need medication and infections of the brain, absolutely. And that's what happens also when babies get infected once they're being born. So seizures and delays. Treatment, the most helpful and the most effective is always going to be oral acyclovir. There are some newer versions of a drug like ganciclovir and valciclovir, but essentially it's that antiviral. You've heard of Abreva, I'm sure. And if you feel that tingle, if you feel that little burning sensation and you start Abreva, you may improve matters. So please, you're welcome to try it, but you do need acyclovir orally to overcome serious illnesses with herpes. We're almost done. Let's talk about scabies. Not a scary STI or STD necessarily, but if you look at that picture on the left, this is a scabies mite. And you can see how scary it can look if it were blown up like 100 times. Now the picture on the right here, this is your skin. This is dead skin, and you see the mite burrowing into the skin. And look where it settles in. It bores a little tunnel, and it goes in, and there it starts laying its eggs. And the eggs cause intense itching, which goes on for months. In babies, the rash is everywhere. In youth and adults, it's usually between your fingers, between your toes, your wrists, your waistline, your ankles. It is treatable. You need to be treated with permethrin. You also need to take all your clothes and wash them in hot water and then dry them at the high cycle. And you also need to repeat the treatment a week later to hopefully avoid getting a reinfection. HIV, not as common anymore. 25 years ago, it was the illness we were discussing and trying to help people. But worldwide, 1 in 7 people are living with HIV, most of them in Africa, sub-Saharan Africa. It is, however, very common in the US, common enough that you should be careful, because once you get HIV, you have it for life. It can be controlled, but never cured. It has 4 stages, just like every other one of those. From syphilis, you have an infection, you have no symptoms, then you get symptoms, and then you get serious disease. And you can't get HIV from kissing, or from hugging, or from sharing, or from insect bites, or from sneezes, or from toilet seats in public places. You can get HIV from sex without a condom, from pregnancies, from sharing needles, and from contaminated blood and other transplants. So please protect yourself. So let's tie things up here. When do you get tested? If you suspect the most common infection, say you feel you have some burning and there's some frequency, you have to go to the bathroom every 10 minutes, you probably have either chlamydia or gonorrhea. If it's gonorrhea, you can get checked 2 days later. Chlamydia, if you go to the doctor and it's negative, but it's only been 1 day, it may be falsely negative. Don't feel safe. Go back in a week or 2 weeks or 3 weeks and insist on another test. And you see different times for testing with each one of those STIs. And when do you expect the results? Your physician, your provider should call you within a few days. Don't assume no news is good news. So if you haven't heard back in a week, don't say, oh, I'm safe. Please call and speak to a person. You need a warm sign out here. A nurse or a provider telling you your gonorrhea test is negative. How are you? Are you better? Why do STDs recur? Could it be that the medication was taken incorrectly? Could it be it was the wrong medication? Like if you treat chlamydia with Herceptin, it's not going to get better. Did you forget to treat your partner? So aren't you not being open with your partner? Or do you have a new STD? So please, if you're not feeling better, do go back and ask to be retested. Stay safe. So safety is key. Stop, think, act. It's everyone's responsibility to be safe, and it starts with you. There are many ways, like we said, to stay safe. If you can't abstain from sex, use condoms. If you use condoms, make sure it's just, one partner. If it's one partner, make sure that they're faithful. Just go down that list. Because you see that little diagram on the right lower corner here. If your partner is not faithful to you, you are not having a relationship with one person. It could be two, could be three, could be five. So please ask questions. Make sure that you know everything you need to know about your partner. And prevention, prevention, prevention. If you wish, you can see about other little video clip I had, but I think I said all I needed to say, and thank you for listening, everyone.
That was so good.
Thank you. Thank you.
I'm not sure how much I said, if I said too much or too little, but I kept our audience in mind and I focused on safety and just, I know pictures are worth 1,000. We are always willing to check. And there's a way to send the test off without making it seem like it's an STI or STD check and make the family really unhappy or beyond unhappy.
I was going to ask a question. What do you think, in your opinion, is kind of the main reason that you don't see young adults getting tested? Do you think it stems from kind of lack of education about STIs, or do you think maybe there's like a stigma there, or?
I remember when I did my adolescent medicine rotation, it was all about the adolescent. It was their clinic, their providers, and everything was rotating around them. We had an intake where one nurse would speak to them, then a resident, which was me at the time, talking to them, without a parent, and then the physician going in. It was all about them. It was 15 minutes to get them to open up, another 15 minutes to get the exam done, and then another 15 minutes or half hour to close the visit. You build trust. But when I think about our situation now, parents sometimes refuse to leave the room. It's all in and out. And you see, Joey, when he's 12, you may not see him again till he's 13. So where's that trust? So what's really helped me, at least personally, I've been doing video visits now for 4 years. You can just say, like, I have a young man now, Jonah, who's depressed and having issues with his parents. I send him an email, Jonah, how are you doing today? Doctor, I need to talk. I flip the message to a video visit, and I'm talking with Jonah. I've had a talk with Jonah once a week for the past 6 weeks. So it's all, I think, about trust. You can't just force, confidences from teenagers you haven't seen. The other thing is, I think parents used to be much more controlling, less so now. But it's a multifactorial challenge. Part of it is not enough time, so that's our fault. And then maybe there's a lack of maybe availability, because sometimes you have to wait for 2 months to get a physical. Otherwise, most people will just not go in. Once you're 4, Aaron, it's amazing how we don't see those kids anymore, except for once a year. So we need to work maybe with schools. Before COVID, I was going out to schools to talk about different health issues. And then 15 months ago, that came to a screeching halt. But we should take those health issues to the school where young people will be there and probably listen. My wife has done that as well, talking about disease, and you won't believe how many kids just come up to her and ask her, oh, is this that? Can we talk a little more? So I think we need to go to the schools to get their confidence.
Yeah, I agree with you. That's what GYT is all about. We're making a website, which I'll put in the chat, that you can check out if you'd like, that we're going to get out to students really soon, that just covers like a lot of these topics, as well as a few others. Also, just a heads up to other GYT people, I'm going to add a page about breast cancer and like early detection, and also some information on asexuality.
Perfect. Yes, that's a new topic. Very good. Very good. Yes. But thanks for having me. And please, if there's any need for other talks, I'll be happy to oblige.
Thank you so much.
Thank you so much.
Yeah,
was
we
gonna
might
say-
be interested in maybe another talk. Kirsten, I don't know how you feel about this, but maybe going into kind of getting tested, but also in the vein of, you know, individuals who maybe identify differently, you know, maybe than their
Yes.
biological
Yes,
sex. So that might be an interesting topic.
absolutely.
Mhm.
I think what I can also do is reach out to one of our partners who's spearheading that effort.
Oh, cool.
Absolutely. We'll be always happy to help anyone in need.
Awesome. Thank you so much. We really
Thank you. Thank you.
All right.
Stay safe,
And
everyone.
thank you, Ms. Irwin.
Thank you, Dr. Madany.
Taylor, stay well.